Most of you may know me. If you don't, my name is Jim Pacheco. I'm a partner at Claritas Financial. And we wanted to do this because we've had a lot of our clients who are asking about Medicare and how it works and what plans there are. And we are not specialists at this. And that's why we have a specialist, Scott Bornford, who's going to give the presentation today as our Medicare specialist. This is really all he does. So he knows the ins and outs. He's always available for questions after the seminar is over. You can always reach out to him. I'm sure we'll have his information too. So this is just a value add for us to give to you to hopefully give you the information that's needed if you're already on Medicare, some of the options that you do have. So Scott, I'm going to turn this over to you. We will have questions after the presentation's over. I believe you can raise your hand and we'll let you have a conversation, or you can email me if you didn't want to do that, if you have any questions going forward, and we'll go from there. So Scott, I'm going to turn it over to you, and we'll take it from there.
Right, Jim, do you want to give your email address in case people want to email you?
Yeah, you can email at Jim, dot last name, Pacheco at LPL.com.
Okay, great. Well, good morning, everyone, and thank you for joining us this morning. My name is Scott Bornfriend with SMS Insurance Agency. We are a fully licensed agency. As Jim stated, our primary specialty is we love working with seniors. We love navigating the nightmare of Medicare and assisting those who are looking to either enroll or looking to evaluate current plans that maybe something doesn't fit anymore. They need to do something else. So what we're going to do is we're going to take a few minutes right now and just go over the basics of Medicare. We have a program, it's called Medicare with Confidence. My goal when we're done this morning is for you to have a much, much better understanding. So you'll know either on your own or with assistance with someone like me, how to properly navigate that. So let me bring up the presentation. Okay, can everyone see the presentation? And David, if you can kind of let everybody raise their hands, I want to make sure everybody can see this. Okay, as I said, the program is called Medicare with Confidence. And we're going to, one second. Bear with me for 1 second. It's not allowing me to tab down from one page to the next, so bear with me. I need to share that again. It wasn't letting me move from screen to screen. I apologize, everyone. Okay. Okay, there we go. Okay, so, as I said, the program is called Medicare with Confidence. Our objective for today is really very, very simple. We want to explain to you some of the Medicare basics, the important terminology that you're going to need to know and understand, talk about the enrollment periods, the different plan types that are available for you, because obviously Medicare is not a one-size-fits-all for everyone. Some plan recommendations, as well as opportunities for cost assistance if that's something that you may happen to need. Right? Medicare is the federal health insurance program. It is run by the Center for Medicare and Medicaid Services, or as we reference, CMS, and they are part of the Department of Health and Human Services. The important terms that you want to know, the premium, which is the amount that you typically pay on a monthly basis for your coverage. The deductible is the amount that you will pay prior to your plan actually providing you with the coverage. So in a situation, let's say if you go to a specialist and you got a $20, a 20% deductible, then you're responsible for 20% of that bill. So we want to find ways and have ways to avoid having you do that. The copay is the amount that you physically pay at the time of the visit, which might be $10, $20. If I'm sure most of you, if you're not on Medicare now, your basic coverage now probably includes some type of copay as well. Your coinsurance is, as I said, that's the amount that you're responsible for, your percentage of the doctor's bill that your insurance doesn't cover. Original Medicare starts with Medicare Parts A and B. It covers many but not all healthcare related services. Medicare Part A is your hospital coverage. That covers any in-hospital stay, which is not the same as an emergency room visit. If you have to go into a skilled nursing facility or home health care or, God forbid, hospice care, all of that is covered by Part A. For the majority of people, there is a zero premium. It's probably the only thing that the government will ever give you that you don't have to pay for. You've only paid for it through your entire lifetime. Part B covers your doctor's visits, outpatient care, any home health care needs, durable medical equipment. If any of you are diabetic, a glucose meter is considered durable medical equipment. Those are all things that are covered. The cost for Medicare Part B is actually, if you take a look at the numbers that are on here, this is a 2025 slide because this is what was previously approved in order to stay in compliance. The actual numbers for 2026 are your premium is $202.90 instead of $185, and your annual deductible is $283. Right, so that means that once you pay your first $283, all your coverage kicks in and pays for everything else. In order to be eligible for Medicare, you have to be age 65 or older, or age 65 and under with certain disabilities. If you are on Social Security disability, then you are able to get Medicare prior to age 65. If you do have any disabilities and you are on a Medicare disability plan, when you turn 65, you have to re-enroll in original Medicare. So it changes once you get back to the age 65 age there. If you are in the fourth month of dialysis and have been diagnosed with end-stage renal disease, or if you are diagnosed with ALS, you also qualify for Medicare. You have to be a citizen of the U.S. or a legal resident for at least 5 consecutive years. Now, there's 3 ways that you can actually apply for original Medicare. Number 1 is you can go to a Medicare office, a Social Security office, and they can assist you with applying for Medicare. You can go online and set up an account at ssa.gov, and then you can actually apply through your ssa.gov portal to apply for your Medicare benefits. Or the third way you can do it is you can call Social Security at 800-772-1213. And in that situation, you might find something to do because a lot of times you'll be on hold for an hour, but they're very, very helpful when you get them on the phone. So you do have those three options available. If you choose to go to a Social Security office, my recommendation would be every Medicare office opens at 9 a.m. Actually, a Social Security office opens at 9 a.m. My recommendation, which I have actually done myself as well, is you get there 7:30, quarter of 8 in the morning, you wait in line. You're normally one of the first 4 or 5 people, and you're in and out the door in 20 minutes. If you get there later than that, 9, 10 o'clock, you may have 30 or 40 people in front of you. You may be there for a few hours. So if you're going to consider going to an office for assistance, my recommendation is get there early. You'll be glad you did, and you'll be in and out in no time. Right. Once you have your Part A and your Part B, there are additional benefits that you can apply for. that will help with out-of-pocket expenses as well as cover prescription drug costs. Depending upon the type of plan you have, some include prescription programs, some do not. There are also programs out there that you can take advantage of that will help you, that we'll talk about as well. There are 3 different options for you as it relates to the type of Medicare plans that you can select. You can have Original Medicare, which is your Part A and your Part B. With Original Medicare, Part A and Part B, you are responsible for 20% of all of your non-covered expenses. And you can get what's called a standalone prescription drug plan. And that doesn't cost you anything more than your $202.90 and whatever the cost for that prescription drug plan is. Or you can have Original Medicare along with what's called a Medicare supplement plan. And Medicare supplement plans, the 2 most popular that are available now are a G plan or an N plan. And we'll go over the differences between those in just a moment. And also, in addition to that, you have your prescription drug plan. So with that type of plan, everything is pretty much a la carte. Your other option is what's called a Part C or a Medicare Advantage plan. Now, if any of you are nearing the Medicare age or happen to see a lot of the commercials and the advertising on TV in the fall, a lot of the insurance companies, they spend a lot of time advertising for Medicare Advantage plans. The difference between the original Medicare plans and Advantage plans are this. With a standard Medicare plan with a Medicare supplement addition, basically you're paying upfront on a monthly basis your $202.90, and then your plan provides all of the coverages that you're going to have beyond that. With a Medicare Advantage plan, a lot of those plans, they come in the form of either a PPO or an HMO plan. And will tell everyone the same thing. I've never, ever been a big fan of HMOs because they're very restrictive. A PPO is perfectly fine. It's a preferred provider organization. Depending upon who the carrier that you would select for that plan is, your initial option is always to go with doctors that are part of that plan's network. And when we work with you, we can actually search all your doctors and let you know which plans your doctors contract with, so you'll know whether that's an issue or not. In those situations, most of those plans have a 0 monthly premium, which is a tremendous benefit. The only downside, if you will, if you want to call it that, to Medicare Advantage plans is they have an annual maximum out-of-pocket expense. The annual maximum out-of-pocket expense ranges from about $6,000 to $9,000. That is what I like to call a catastrophic event cost. If, God forbid, you fall and you break a hip, you have a heart attack, you're in the hospital for an extended period of time, that's where that maximum out-of-pocket comes in. And that doesn't include going to a doctor's office or things like that. For a doctor's office, you may have simply a monthly a co-payment for each visit. So, but the other thing just to think about with regards to that, you're not paying a monthly premium. So if you have that catastrophic event, that's where that kicks in. When you have a Medicare supplement plan, you're paying roughly $2,400, $2,500 a year for that plan, whether you use it or not. So that's really one of the major options there. And everyone has their own specific needs. I always like to sit and give you all the options when we talk about it, and you can make those decisions at the appropriate time. But those are your different types of plans that you do have available. If you have a supplement plan, then you can get what they call a standalone prescription drug plan, which is your Part D coverage. There used to be about 30 plans available. There's now about 5 or 6. So the options are significantly less. It's important to know what types of medications you may be taking on a regular basis, because that will also help to determine the type of prescription drug plan you may need. If you have, as I said, if you have a supplement, then you get a standalone plan. If you have and select a Medicare Advantage plan, most of those plans include that prescription drug coverage as part of it, so you don't have that additional cost. These numbers are slightly low. Just because we are obviously now in 2026. There's roughly about 20 million Americans are on Medicare supplement plans. The keys to the Medicare supplement plans are that it covers all your costs that are not covered by original Medicare. Any out-of-pocket costs that you have are only going to be any copays or your annual deductible. They reference an F plan. The F plan is really no longer available. It's primarily a G plan and an N plan. The difference between the G plan and the N plan is simply with the N plan, you do have a possible copay when you go to a doctor's office. With a G plan, you don't. The N plan runs about 30 or 40% less than the G plan. So the trade-off is you're paying a little bit less upfront, and you just pay a little bit when you go to the doctor. As with all Medicare plans, they're sold by private insurance carriers. The premiums do vary from state to state and by different plan. If you are new to Medicare, there is no underwriting required. If you're just turning 65, you are automatically guaranteed to be approved for whichever plan you select. And I apologize, I'm in the midst of horrible allergy season, so I do apologize for a little bit of coughing here and there. A Medicare supplement plan is always going to be paired with a original Medicare and your prescription drug plans, and you do have to be enrolled in Medicare Part A and Part B to be eligible for a supplement plan. Your Medicare Advantage plans, similar from a standpoint of you do have to have Part A and Part B. You enrolled in both of those. When you select a Medicare Advantage plan, that actually covers your Part and your Part A and your Part B benefits through the carrier that you have your plan with. They normally do include prescription drug coverage. As I said, most of the plans have a 0 monthly premium. They do have the out-of-pocket maximums. They have networks of doctors and hospitals. We evaluate all those based upon who your doctors are to make sure that you don't have any issue with going to your doctor when you have one of these plans. They, just like supplement plans, they are all sold by private insurance companies. They are normally guaranteed issue, even if you're already on Medicare and you're looking to switch from one plan to another. Advantage plans are automatically guaranteed issue anyway. You don't get an Advantage plan and a supplement plan. You either select one or the other, and that's a decision that you make when we sit down and we review the different options available for you. If you are already on Medicare, then you have the annual enrollment period, which runs from October 15th to December 7th of every year. During that 57-day period, you are able to evaluate any other Medicare plans that are available and make a decision if you want to switch from one plan to another. If you make that decision to switch from one plan to another, that the effective dates are always the 1st of January of the following year. So anything from this October to December would be for 2027. If you are currently on Medicare and you have a Medicare Advantage plan, you also have a second period from January 1st to March 31st of each year where you can change your Advantage plans. Or if you decide you want to go back to original Medicare, you can do that as well. You can't change from one supplement plan to another. You can only do this for the Advantage plans. If financial assistance is needed, there are different types of plans that are available that you can take advantage of as well. There is the PACE plan, which is a program for all-inclusive care for the elderly, which is part of Medicare itself. There's also SSA.gov has extra help. There's a Medicare savings program. And if you are low income, then you have Medicaid available as well. There are what are called dual special needs plans, which include Medicare and Medicaid. Not included on here, especially if you are all, for those that are in New Jersey, there is a program called NJPAD, which is PAAD. The NJPAD program is for anyone who earns less than $58,400 per year. It is a prescription drug plan that allows you to, if you're approved for it, basically says regardless of what type of medications you take, you'll never pay more than $7 for any prescription that you have. So if you are in that under 58.4 income limit and you have medications, even if some that are expensive, that's a program that you can certainly look at and take advantage of. Okay, just for fun, we normally do this when I do my live presentations. 2020, there were actually 4.69 billion prescriptions filled in the United States. So obviously, lowering prescription drug costs is something that's very, very important to everyone who takes any type of medication because they can be very, very costly. So there are different plans available. As I mentioned, the NJPAD program. There are also, if you are taking a generic medication, sometimes one generic is less expensive than another. Sometimes one pharmacy is less expensive. You can also possibly choose or have your provider provide a different medication that does the same thing that may save you some money. Some of the manufacturers offer coupon or patient assistance programs that help to cover some of those costs, or you can look at other health plan options that may provide you with better prescription drug coverage if it's needed. There, as I said, there's plenty of different plans that are out there and that are available. Here's what you want to think about when it comes to selecting a Medicare plan. You want to look at what your budget is. What can you afford? You want to look at who your doctors are. Which plans do your doctors provide, are contracted with? Not every doctor has Aetna and United Healthcare and Cigna and Mutual of Omaha and all the rest. So you always want to look at that. If you do take medications, you want to take a look at what your drug costs are. You want to look at what your frequency of care is. If you don't go to the doctor very much, there are certain plans that are more beneficial. If you have ongoing medical conditions that require more care, then you want to take that into account as well in looking at the type of plan that you want to consider. You also want to look at what your likes and your dislikes are. Some people have had bad experience with different carriers, so you stay away from that carrier and go with someone else. If you travel a lot, that's important as well, especially if you travel internationally, because there are international healthcare plans that provide additional coverage beyond the basic coverage that Medicare provides, because Medicare is not going to cover you on a safari in Africa if, God forbid, something happens and you get sick. And there's other decisions you want to make as it relates to looking at the plans as well. When choosing an agent, if you choose to have someone assist you with looking at and finding Medicare coverage, you want someone who's authorized to provide that assistance and the advice. As a Medicare specialist, we have to recertify with every single carrier that we work with every single year. We are constantly going through additional retraining every single year. We have ongoing continuing education. Our services are offered at no cost to you. We are compensated by the insurance carriers, and we don't have any loyalty to any one carrier. That's why we have options for all the different carriers available. If you speak to an insurance agent and they want money up front from you, my recommendation is you need to go find another insurance agent, because it's illegal. And to be honest, I can lose my insurance license if I take money from someone. I'm not about to do that. The biggest benefit that a licensed insurance agent offers you is we save you time and we save you money by helping navigate through all the different Medicare plans. You basically are going to have 30 or 40 different plans to choose from, and that's an awful lot to have to go through. So just as a quick summary on all of it, and as we call the ABCDs, Part A is your hospital coverage. As you can see, days 1 through 60, there's a zero copay for hospitals. If you are in a long extended hospital stay beyond that, once you get to day 61, there are copays that are required to be paid. If you have a Medicare supplement plan, that covers that. If you have a Medicare Advantage plan, those will be covered as part of that once you hit your maximum out-of-pocket expense for the year. Your monthly cost for your supplement plans, as I said, these are the 2025 numbers, is $202.90 per month. The deductible is $283 per year, plus the 20% coinsurance that is covered by your supplement plan and or your Advantage plan. For your Advantage plans, they are PPOs or HMOs. I highly recommend, if you want to consider an Advantage plan, you want to stay away from the HMOs as much as possible. You'll have more flexibility with a PPO. If you select a supplement plan and need a standalone Part D prescription drug plan, the average cost for those plans are roughly between $20 and $100 per month. There are some copays that you will pay on that. Every plan is going to be different, and every plan evaluation is based upon any medications that you currently take, and we want to evaluate to make sure we can save you money on those. I am now open to any questions you may have. David, we can certainly open that up. Jim, if anybody has emailed you with any questions, or I'm more than happy to answer directly for anyone who may have any from here.
Yeah, we didn't get any emails except for can we share the slides? And we are looking into that with our compliance department to see if we can share the slides. So
Okay.
as soon as I get that answer, I will let people know.
Not a problem. David, any chats with you that we have questions to be answered, or anyone interested in asking any questions?
We got one person who raised their hand, so I'm gonna unmute them now.
Okay.
Hi.
Good morning.
How you doing?
How are you this morning?
I'm okay, thank you.
That's good.
I am not 65. My husband is about to turn 65. I am the one who has all the health benefits. What must he do, and what is the minimum? Like, I don't know how to navigate this through my company.
Okay. That's actually a fantastic question. Here's what you really want to do. You want to do a comparison between the plan that you have and the coverage that you have now as compared to what the cost would be for your husband to leave your plan and go directly onto Medicare. Sometimes, depending upon how much you're paying extra for him to be a part of your plan, it sometimes can be more cost effective for someone to enroll directly in Medicare. But you need to find out a number of things. Number one, do you happen to know what you're paying for your husband to be on your plan now, what his cost share is?
It's family, so it doesn't matter if he's on or not.
Okay. All right. So if you're on a family plan now, how much longer do you anticipate working and keeping that coverage?
I would say 3 to 5 years.
All right. My suggestion, not knowing the exact numbers, but if you have an all-inclusive plan, I would stay with what you have now, because otherwise potentially it could be costing you more to have your husband go directly on Medicare, because we know if he's got Part A and Part B, right off the bat, you know you're going to be spending an extra $2,500 a month without a supplement plan. So that may increase your healthcare coverage costs, which is what you want to avoid. The only caveat to that would be is if your husband has any existing health issues that may potentially increase in severity over the next few years, there may be a benefit to swim now, because between your deductibles and your copays, the cost may be less if more doctor's office visits might be required, or other type of testing and care. But that would be something that's a much more detailed conversation that I'm more than happy to work with you on if you wanted to evaluate that. But you definitely want to consider and see exactly what the coverages that you're provided are now through your current plan, and if it makes sense, you just stay with that and save the money.
But don't we have to do something with him, like in a certain time frame? Does he have to?
He can apply for Part A, but as long as you have credible coverage in place, you don't have to enroll in Medicare Part B until the loss of credible coverage. So as long as you're working and you provide family coverage, the only thing he could do is apply for Part A, but he does not need to apply for Part B and include that expense right now.
So it's a must, right? He must apply to Part A.
He should apply for Part A, yes, if they don't automatically enroll him in it. Sometimes Medicare will do that on their own, but he should definitely get Part A when he turns 65, because there's no cost for it.
Okay. And when he's 65 or prior?
When does he turn 65?
December 1st.
Okay, you can apply up to 3 months prior to your birth month. So realistically, he can apply for Part A in October.
Okay. Thank you. And then I don't have to do anything with my company, right? I just leave them alone. That's all we do. Okay.
You can leave them alone. You don't have to worry about anything. The one thing I would do is I would just get a breakdown on what your current benefits are, and just see how much is your annual deductible. What are you paying for copays right now? And is it just you and your husband that are on the plan? Are there any children on the plan as well, or no?
Yeah, we have a 24-year-old and an 18-year-old on the plan.
Okay, so the two of them, so the 24-year-old can stay on the plan for another 2 years.
Mhm.
When the 24-year-old turns 26, she will have to get their own coverage. The 18-year-old, you can keep on that plan as long as you have the plan, so you'll be fine with that.
Okay.
So yeah, I would just look at just do a comparison and see what those numbers are, just to make sure it makes sense for him to stay on that plan. But I think it probably would.
Okay. Thank you.
You're very welcome. Any other questions? David, anyone else?
At this moment, no one has their hand raised.
Okay.
All right, great. Well, I hope everybody got some good and useful information on this program. You can see Scott's information is on the screen now. You can always reach out to me or my partners or anybody in that group if you have any questions. We will make this program available, or this webinar available for people to review. And again, I hope everybody got some good information. We will do these on a periodic basis. Also, we will do them live in the office when we get a chance to do that, but we wanted to also invite people who couldn't make it to the office this time. So, well, I appreciate everybody joining. And again, there's Scott's information on the screen now. You have my information if you need to contact me. And hopefully we'll hear from you, or if you have any questions, and you got a lot of good information out of this.
Well, thank
So
you
take
very much,
care.
everyone. Thank you, everyone, for joining us.